Anybody of you know who are the members of that group? Any thought about this?
Faculty.
Faculty, right. You are absolutely right. So faculty will be the one thing is the faculty of the institute. Anything else? Do you think only faculty from the institute are part of the committee, or do you think there are people who are from outside of it?
Also, independent members.
Independent members. Very good. So those are independent. That is what the word we have used. Those are independent members who do not know anything about the people who are submitting the project. So they are unbiased. So that is why they are known as independent members. So who are these independent? What do you think are the profiles of these independent? And why I'm talking, because ethics committee is something which is laid down in the by law, that this is what is the composition of an ethics committee, right? So that is, so you have independent members, and then the independent members are also quite well defined, that who are the members of the ethics committee. Okay. So the other name is, you must have heard about IRBs. If you read papers, you must have seen that in the material and method section, you'll find that the project or the study was approved by the IRB. They use the word IRB. So that is the Institutional Review Board. We at SGPGI use the word Institutional Ethics Committee, that is IEC. And they look at all studies, all research studies, whether they are academic, clinical trials, intervention studies, whatever the study type may be, it has to go through the ethics committee and has to be approved by the ethics committee. And all of these ethics committees are multidisciplinary committees. Okay. So this is what I was talking about. So whatever is the constitution of the ethics committee is laid down in the Gazette. So that is how the ethics committee is formed. It is not in our whims and fancies that we can constitute an ethics committee as we want. So there are definite guidelines for the ethics committee, and this has come in the NDCT rules, which are 2019. So those who go in further for academic posts, they will realize that everywhere there is a reference of NDCT rules 2019. So these are a very important group of rules which define the constitution of the ethics committee. And it is according to this, which is laid down in the Gazette, that you have to form these committees. Okay, so if you look at this, the constitution, it says should have minimum 7 members. And as you said, there are dependent and independent. Independent, those who are not affiliated. So we use also the word, instead of using independent, we can also use affiliated or non-affiliated. Affiliated who belong to the same institution, and non-affiliated who do not belong to the institution where the ethics committee is being formed. So these constitute medical, non-medical, scientific and non-scientific areas. So you have to have one lay person. Why do you think you need a lay person? Lay person. What do you understand by a lay person? Can you be a... So the question for our ethics committee, you may not be lay person. Can you be lay person for any other ethics? So you got the meaning of lay person. It is not just being non-affiliated. Lay persons, it depends in which committee you are going, right? If you are going to a medical committee, another ethics committee, which is not in your institution, any other institution, still you will not be called a lay person, because then you will be a scientific member, right? You understand? So you have to have a lay person who is generally from the community. In places where you have like people where you do leave, for example, tribal people, you can have lay persons who belong to that tribe, who know the problems of that tribe, who know that what has to be done for that tribal people. So accordingly, you have to have one lay person, one woman member, one legal expert, and one independent member from any other field, such as social scientists, NGOs, philosopher, ethicist, and theologian. Theologian, do you know what is the meaning? What is a theologian? Anybody? On that, not given any answer. Theologian, it is an English word. something related to whatever I've already said. So what is a theologian, anybody?
Religious. Religious expert.
So you have religious. So you may have studies which are dealing with a particular religious mandate or something, belief, right? So you can have a theology. So as you said, independent. So we can use the word non-affiliated. 50% of the members have to be non-affiliated. And the chairperson of the committee is always a non-affiliated member, and the member secretary is always an affiliated member, and at least one non-scientific member independent of the institution. Okay. So do you know who is the member secretary of our ethics committee at present?
Dr. Durga.
Good. You seem to have submitted all your projects, no? So, because all the answers are coming from you. Okay. So Dr. Durga from Department of Immunology. Okay, so it is required that the EC members should follow the NDCT rules. So that is why it is a mandate that all ethics committee members should read the NDCT rules, and they should know what are the good clinical practice guidelines, other regulatory requirements before, and that is why they have to sign those documents also, the confidentiality document, the conflict of interest document, and they should also have a GCP certificate so that they can become EC members. So they basically, what do you think is the job of the ethics committee? The principal job is what I've labeled it, is to safeguard the rights, the safety and well-being of the trial participants or the study participants, right? So those who are participating in a study or a trial have to be taken care of. And this is the basic theme of forming an ethics committee with all of these different types of members and at least 50% of non-affiliated members. And as I said, they should have a training. So the ethics committee constitution minimum is 7. Generally, we have 7 to 15 members. And the quorum requirements means when can you convene a meeting and start a meeting of the ethics committee? At least 5 of these members should be present, including a layperson, a social scientist, and a legal expert. Of course, the chairperson and the clinical person. Okay. So this is what is the constitution. As I said, chairperson non-affiliated, member secretary affiliated. Others, basic medical scientists, clinician, legal experts can be affiliated or non-affiliated. And the layperson, of course, is always non-affiliated. So all of you have seen where in the website we have the ethics committee. So if you go to research, then you have something like an ethics committee here. If you click on this, you will go to this page. It will talk to you about what is the present team in the ethics committee. And these are our standard operating procedures. The last one was from January 2018. This is still in use. And then if you see the left-hand side banner, you can see the proposals for ethics review. You can submit it online. And this is an online submission portal for ethics, for reviewing of projects for ethics committee. Okay, so as I said, the principal function is to safeguard the participant. And then you have to see that the EC is competent and independent in its functioning. These are the 2 parameters that are very, very important. And the research proposals which come to the ethics committee are not just initial proposal. When you start the study, that is known as initial. But you also have to send it to the continuing, that is after 1 year of your proposal. And this is more true for clinical trials and intervention studies, where you have to see that the participants may have something which may harm them. So you have to keep on telling the ethics committee that this is what we are doing. So it is good. It is a good practice if you give for academic studies also an annual report or a continuing report. But for clinical trials, it is absolutely essential. And it is responsible for scientific and ethical, both ethical and scientific. Sometimes you may worry that why is the ethics committee talking about science and all of this? Because that is also the mandate of the ethics committee. They have to see if the project is going through, whether it is scientifically valid, whether a PI who has said that I'll be doing this amount of work on this participant, whether he or she is competent enough to do that project. You cannot leave the participants at the mercy of the PI. Okay, so that is why both ethical and scientific review has to be done by the ethics committee. I talked about principles of ethics that day. If you remember, we also talked about principle of essentiality. I showed you the 12 parameters of ICMR. So one of them is the principle of essentiality also. So all of these things are looked by the ethics committee. So this is something is an assessment form. I wanted to show you this to just let you know that this is how the ethics committee members look at the project. So we have made it like what are the scientific and the ethics issue, labeled them that these are the scientific and ethical issues which have to be seen in each and every study, so that it becomes easier for the reviewer to review the project. So whether human participants are required or not, whether the investigators have a qualification and experience and all those things, inclusion criteria, exclusion criteria, control arms if it is a clinical trial, and of course facilities, all of these things, and of course ethical and informed consent issues. So these have been numbered so that all of these issues are taken care of. So the ethics committee also can have subcommittees. For example, what is SAE? We have an SAE subcommittee in our institute. What is SAE? Anybody who must know SAE? What is AE? So S is? Okay. So serious adverse events. Okay, so that is a subcommittee. It looks at clinical trials. If there is a SAE, the PI has to report. So there is a guideline in which time you have to report it to the ethics committee. The SAE subcommittee then looks at it and gives a report which is sent to DPDI so that compensation for that participant can be decided. In our institute, we have had SAE subcommittee meetings several times, and we have been able to get compensation for our participants a number of times from the sponsors and from the drug companies. So that is why SAE subcommittee is really very important. And then you also have an expedited review committee. This is a committee which is not a full board committee. It has few members which look at academic trials in which no intervention is being done. For example, yesterday you were talking about retrospective trials. So in that, you don't need a ethical full board committee to look at it. A small review expedite committee can look at it and approve it. Okay. So these, I talked about the members of the ethics committee. So this is the chairperson. So the role of the chairperson is basically to conduct the ethics committee. They have to ensure that it is independent and efficient, ensures quorum. So it looks at everything, the complaints, members, everything is being looked by the chairperson. Then you have the member secretary who is affiliated, non-affiliated. Affiliated. Okay, so the member secretary who is basically looking after the office of the ethics committee, that is what are the procedures. You have to receive it, document it, schedule meetings, see the quorum is complete. They have to see for continuous reports and everything. Then you have the basic medical scientist who looks at scientific and ethical review. As I said, science and ethics both have to be looked. Benefit risk analysis. They have to also look at continuing review process. And for clinical trials, generally we have in our ethics committee a pharmacologist who is competent enough to look at the drug which is being used in an interventional trial. Then you have the clinician. So again, the job of the clinician is almost similar to the basic medical scientist, but they also look at whether the medical care which is being given is appropriate or not. And then you, of course, have a legal expert. Why do you think a legal expert is required? Basically, clinical trials, right? You are giving a drug to a participant, right? If there is a serious adverse event, you have to also have to see that whether the compensation issue, the insurance, the clinical trial agreements, everything is in place. So at a later date, if something happens, then you are able to cover the participant. And of course, also the PI. So that is why the legal expert is really very important for the ethics committee. You cannot have an ethics committee institution where clinical trials are undergoing and you do not have a legal expert in the committee. So they look at memorandum of understandings, the informed consent documents, the regulatory approvals, insurance, and all those things. So regulatory things all are looked by the legal experts. Okay. Then you have a layperson. So So as I said, they act as they are from the community. So they are representatives from the participants community, and they look at participants' perspective. And these are the persons who are given the ICDO, the PID, the participant information document. If they are able to understand all the scientific jargon, then that means the patient will also be able to understand. So that is why it is important for the lay person to understand your PID. So that is what we do. The ethics committee members, the lay person gets the PID to read it. If he can understand it, and if they think that the participant will be able to understand, it goes through. So then you have the social scientist, philosopher, or an ethicist, or a theologian, again, who looks at the social part of it. Again, he or she is a representative of the community. It is basically true because these guidelines are not just for medical institutions. These are guidelines for all institutions. You have institutions in which there is a lot of studies on social aspects, right? So therefore, you have to have all of these members, right? So they look at the community involvement, socio-cultural context, religious or philosophical context, etc. So then what is the role of the bioethics cell? So you have an EC office. Anybody of you knows where is the ethics committee bioethics office? Have you ever gone to the ethics office, bioethics office? Or all of you have submitted your proposals, ethics committee? So because you're submitting it online, but you also have to submit a hard copy in the bioethics cell. You know that? Right. So where do you submit it? One person? Administrative block? Good. So room number 105. As soon as you climb the stairs, the room is there. Okay, so the ethics committee has a lot of roles. One is, as I said, to the investigators, they circulate the meeting agenda and decision letters and communication. They are also responsible for communicating with the regulatory authorities and DCGI. Right? As I said, when you have a serious adverse event, the ethics committee reports to the DCGI. So the ethics committee has a role to communicate with other ECs also. Suppose you have a collaborative trial and you think there is something which is of concern. The ethics committee can communicate with the other ethics committee who has already given an approval to see what are the guidelines and why approval has been given for some study. Okay, so what are the type of decisions? Anybody of you have got a decision letter from the ethics committee? You submitted a project and you got a letter from ethics committee? Nobody? सबके submitted किसी को नहीं मिला? मिला किसी को? No. किसी को मिला होगा? किसी के submitted नहीं है. नहीं, they are saying submitted. कुछ लोगों ने कहा submitted. You have submitted. Just raise your hands. Okay, one. धीरे-धीरे दो से करो. किसी को ethics committee का कोई लेटर मिला है? किसी ने देखा? नहीं. So these are the decisions which are given, whether it is approved, whether minor revision, revision with major modification or not approved. For academic studies, generally, you may have minor revisions. And 99% of times, the minor revision is, we were talking about it yesterday, is it? PIH, right? Because generally, your department already DRC is held, the department approves the project. So the only problem 99% of times is for the PID that you get minor revisions. Okay, as I said, it is not just the initial review, you also need to have a continuing review. So the ethics committee looks at the continuing review. It can look at it in the full board review or in the expedite review. And basically the aim is to see whether the risk assessment does not change with time, right? Sometimes it may change. Today you may think when you're starting the study, there are no risks. After 6 months or 7 months, you realize, no, these are the adverse events that the participants are facing. And then it needs to be reviewed again. Basically, more true, as I said, for clinical trials. And as I am again and again saying, it is a responsibility of the EC to look at scientific, ethical, medical, and social. Why have you come at 3:30, sir? Why did you come at 3:30 and go home? Absolutely. कभी भी मैं आपकी क्लास में This is not done. There has to be some rule, like 310, 315, even coming up to every 5 2 people. What is this? Which department? Nephrology. What were you doing? You were there when? I see. You were not relieved from the department? What is your name, both of you? You write, when you sign, you say we were late, we came at 3:30. I'll talk to your head of the department. So, as I said, it is an annual review. So this is just to give you an outline that how continuing review, what are the things that the EC looks at? The progress report, whether there is protocol deviation, and I've also given you all the definitions. What is protocol deviation? What is protocol violation? Basically true for clinical trials. What is non-compliance? When you do not follow the regulations. What is a serious adverse event? It is an adverse event. And the research outcome is death or life-threatening, right? That is why you need to give compensation for these. Then what is the role of the EC in all of these? So if they look at the progress report and see if there are any altered risk in the study, reports of monitoring by the sponsor, and DSMB. DSMB is Data Safety and Monitoring Board, which we will talk on Saturday. There will be a separate lecture for this. And what do you do for protocol violation and deviation? You see for corrective actions and halt the study if required. Non-compliance, of course, you review, monitor, and see what you can do about it, or you will have to halt the study. And of course, SAE, as I talked about, the NDCT rules, according to that, you have to give compensation. And again, the decisions are almost similar, whether it has to be continued or not. That is basically for clinical trials. What do you understand by vulnerable population? This I just wanted to introduce to you that you should know what is a vulnerable population. And EC looks at it very strictly. What do you think is a vulnerable population? I've already said. So these are individuals who are incapable of protecting their own interests. And for a particular study, there may be vulnerable population for that study, may not be vulnerable for others. So it is not a generalized thing. For example, pregnant women may be vulnerable in one study, may not be vulnerable in the other study. Right? So that is how it changes according to the study. So generally there is a belief that women, children, and all pregnant women are all vulnerable population. No, it is according to the study. So when you say vulnerable population, yes or no, you need to realize whether it is really vulnerable for that study that you're doing. Okay. So why are they vulnerable? That I've already said. So when we have a vulnerable participant who is involved, the ethics committee has an extra effort, puts in an extra effort to see that it is a full board review and all participants are protected. So the responsibilities lie with the investigator. Hello, sir, what is your department? The EC has a role and the sponsor. Okay, so these are the guidelines. Who showed you these guidelines? Before me. At least you could register that. Dr. Rakesh Agrawal also showed you these guidelines at the end, right? Okay, so these are very important guidelines. If you have anything which you want to refer to, you can go back to these guidelines which are applicable in the nation. And these are guidelines which have been also internationally, people have seen these guidelines and they are really good guidelines. So that is, and they're freely available. So just need to see that it is 2017 is the latest. So this is what I just wanted to say, that ethics is all about being human. What you can do for your participants and behave in a humanly manner. That is all. Any questions?